You immerse yourself in a very private conversation with someone who's sharing their thoughts in such a candid way.
Getting an insight into somebody's journey in that way is really powerful.
Just such an amazing concept, very simple yet so engaging.
I walked in Becky's shoes, a working mum caring for a little boy with severe learning difficulties and juggling her life. It was just humbling.
It's quite an emotional experience to really get under the skin of what it's like working in an emergency department for a long shift.
Looking down and thinking that she'd worn these shoes with her struggles made me really be able to hear her story and really empathise with her. It was great.
The main thing I learned was that sometimes we need to take a bit of time out and put ourselves in other people's shoes. In a field as challenging as healthcare, making those personal connections makes a difference.
It's really important in my role as a civil servant to gain an insight into how frontline staff do operate and specifically the challenges that they're facing to try and inform the policies that I work on.
I hope it will really help me to be more empathic with the people that I work with, be they patients, carers or staff.
I was listening to a guy who was a night porter, and I think it made me feel very lucky that we have these amazing people in the NHS. You know, it's great to take the time to just recognise that it's the people that make the NHS work.
To find out more about A Mile in My Shoes, please visit health.org.uk/A Mile in My Shoes.